Good afternoon, and thank you again for joining us today for our January Choices Community of Practice Coffee Chat. It's our first coffee chat of 2025, so we're excited to be kicking off another year of these great events. The topic for today's event is creating healthier spaces for kids, a walkthrough of OSNAP resources for out-of-school time. My name is Molly Garrone. I am a Senior Communications Coordinator for the Choices Project at the Prevention Research Center on Nutrition and Physical Activity at the Harvard T.H. School of Public Health, and I will be the moderator for today's discussion. I would like to acknowledge our funders who make this work possible and mention that our Choices work and events are only for research and educational purposes. The purpose of today's coffee chat is to provide information, tools, and resources to inform and educate, and we are not looking to influence any specific legislation. I also want to note that myself and our guest speaker today are sharing personal perspectives, and we do not speak on behalf of Harvard. If you are unfamiliar with the Choices Community of Practice, we are a network that includes people whose work focuses on advancing obesity prevention, healthy eating, and active living, and want to learn more about how cost-effectiveness analysis can advance their efforts and address health equity. Our coffee chats are unique opportunities to share ideas and enhance connections in an informal setting. So today we will start by hearing a presentation from our speaker, and then we will open it up for a full group discussion and Q&A. But please do feel free to share any questions or comments in the chat at any time today. Today's coffee chat will feature a demonstration and walkthrough of the key features of the Out-of-School Time Nutrition and Physical Activity Initiative, or OSNAP website, specifically the MyOSNAP section, which you can use to assess how closely your program practices and policies align to the OSNAP goals. And you can also create a customized action plan to ensure healthy changes. So we're really excited today to be joined by a guest speaker who is a member of our own team, Dr. Bekka Lee. Bekka Lee is a lecturer on social and behavioral sciences at the Harvard T.H. School of Public Health. She has spent nearly 2 decades working at the Prevention Research Center on Nutrition and Physical Activity, where she uses mixed methods to conduct research and evaluation with partners at the Boston Public Health Commission, Massachusetts Department of Public Health, and the YMCA. She was part of the team that developed the OSNAP intervention and led a study testing its scale up to after-school programs across the country. So welcome, Bekka. We are really excited to have you with us today. Without further ado, I'm going to turn it over to you, Bekka, for your presentation.
Great. Thank you so much, Molly. I'm really excited to be here today. So as Molly shared, OSNAP, or the Out-of-School Time Nutrition and Physical Activity Initiative, is really focused on identifying and supporting lasting, cost-effective policy and practice strategies in after-school programs. And it's focused around increasing access to healthy foods and beverages, increasing physical activity opportunities for kids in those programs, as well as reducing screen time through computers, movies, digital devices, things like that. And so OSNAP really aims to bring together out-of-school program providers to learn from one another and set goals to meet the OSNAP goals or standards. So OSNAP was developed, as Molly mentioned, as part of the PRC core research project several years back. And we've really made great efforts to sustain this work through this website so folks can do this on their own beyond a research setting. So next slide. So why would you want to implement the OSNAP model in particular? So the first thing is that it's evidence-based. There's really a very strong evidence for this approach that we tested here in the city of Boston through a group randomized trial. In that research, we saw increases in the water that was served to kids, as well as the consumption of that water, policy changes across a number of different nutrition and physical activity outcomes. Healthier foods were consumed by the kids that were in the intervention sites, and we saw increases in vigorous physical activity. So across all the different goals we're looking for, we really saw great progress. I also led a study that looked at scaling this up nationally with partners at the YMCA, and we saw that beyond just our local Boston context, that OSNAP works well in various parts of the country, in both urban and rural and suburban settings. And so we really think that this model can be helpful for folks like you who work in after-school programs or work with after-school programs. It also has goals that are aligned with the HEPA standards, or the Healthy Eating and Physical Activity Standards. These may be familiar to some folks. It may be a new acronym to others. But this is one way of achieving those standards that are kind of common in the field. And we've made great efforts to make sure that those goals are aligned for programs. And then it also helps programs meet federal, state, and local policies in terms of the food served or physical activity offered to kids. Next slide. So the OSNAP model we think of it as kind of this cyclical pattern where we have folks first assess their program policies and practices to be able to identify the goals they might want to focus on during that school year. Then they come together to learn from one another or use some of our materials to learn independently about how to improve the practices and policies of the program. Then they identify which of those practices or policies they'd like to focus on. They implement action plans to try to reach those goals. And we also really encourage people to implement in small steps, try something out, see if it works, come back and tweak it. And then communicate out those changes to both the kids themselves in the program, the staff, the families, and the partners they're working with. In addition to that baseline assessment of what's going on at the program, we have people track their progress over time with their action plans and reevaluate at the end of the school year or the period of time they're trying to make change. So we can really see if there are changes in those practices over time. Next slide. So what do I mean by the types of healthy changes programs can make? So a lot of the time when we're thinking about nutrition and physical activity, we're thinking about changing the kids' behaviors themselves, encouraging them to eat more fruits and vegetables or participate in more physical activity. And OSNAP really goes beyond that to get people thinking about what ways can they change the program practices at their after-school program that then influence child behavior. So not one by one intervening with kids, but changing the setting of their after-school program. So changing things like their day-to-day operations, like serving water at snack time on the table, or offering more options for physical activity that are appealing to a wider range of kids in their program. They might also think about changing things like policy. And when I say policy, I mean informal policies, like just changing the written schedule or the menu. Or it could be formal policies, like a parent handbook or staff manual. But these are still usually policies that are happening at a program or organizational level. We're not saying that we're changing larger city, state, national policies in this context. And health communication is the last piece. So things like sharing out health information, changes to your practices and policies with various folks connected to your program. Next slide. So there are a variety of ways to bring OSNAP to your program. Before I dive into the website, I just wanted to kind of walk through all the different ways. So I mentioned that this is a way that we bring staff together to build their capacity. And so if that is really something that you're interested in doing, that would be, building capacity through our learning community model. We have a train the trainer model where we can train folks on how to bring OSNAP, the whole learning collaborative approach to your area or to your network of after school programs. We also have things like implementation guides and facilitator guides. So you can really take those from our website and do it independently without even needing our train the trainer. So if you want all of OSNAP, you could do that. You could also create an OSNAP account to track your progress and develop a tailored action plan. This is something you could do as part of a learning community. If you're working with maybe 10 other after-school programs in your state, you could do this all together. Or if you're really motivated to just do this on your own, you're a single after-school program, you could do that as well. We'll also show you today how to explore our resource library for practice and policy strategies. So this is a complement to our learning collaborative and our tracking of progress, but it might be that you're just really interested in a particular health topic area, say serving water to kids, and the resource library can help you find just materials around that particular health topic. And then finally, you could participate in the on-demand self-paced online course that's offered by Better Kid Care. This is a really amazing collaboration we have, and this partnership allows people to take the learnings of OSNAP on their own in a self-paced way, and it is paired well with our website and other materials. So next slide. So I'm going to be taking you to our OSNAP website very soon. This houses all of our OSNAP materials, our resources, our learning community materials, and it has this amazing MyOSNAP portal where you can do these interactive assessments and reports. This is a new revamped OSNAP website. So for the quarter of you that have seen OSNAP before, it may look different to you today than it did the last time you looked. And we've made it much more easy to jump in and develop that profile for yourself and track your progress over time. I'll also just name that OSNAP materials are all free of charge on our website. It's really important to us that you have access to these materials and use them for whatever purposes you need at your after-school program. Next slide. So here are the types of materials that you'll find there. I mentioned the implementation guide and learning community facilitator handbook. You'll see the practice and policy assessments, action planning, the tip sheets and fast maps that are all health topic specific that help you dive deep into that particular health topic you're interested in. And our policy writing guide is really fantastic. It really helps people think about how would I craft a policy to align with the practices I'm trying to change? Where would I put that? How would I phrase that? And we use a lot of policy language that were written by after-school program providers. So we're not making up that language. They've developed it and we've adapted it and put it in this guide. Next slide. So let me tell you a little bit more about our implementation guide. So the implementation guide is a step-by-step guide for improving nutrition and physical activity. It's designed with both after-school program site directors as well as OSNAP coordinators in mind. And so it could be the leader of a site, but it could also be somebody who's coordinating multiple sites at a higher level, bringing folks together. It provides materials for programs to use directly with kids and their families, as well as our food and fun curriculum. And it directs users to training templates, action planning guides, to really bring staff on board, to stay organized, all of the project management that you would ever need to implement OSNAP, as we did in our research study, is all in this implementation guide. And you can find this in the Learning Communities tab of our website, as that you see in the top right corner here. Next slide. Also on that tab, you'll find our Learning Community Facilitator Handbook. This is really meant to be paired with the implementation guide, and it goes through the entire OSNAP approach for making change, and it provides step-by-step instructions on how to run each learning community. So we're talking about a 1 or 2 hour session where you're bringing folks together to build their knowledge and skills. We have PowerPoint slide decks, we have talking points, all of it's there for folks to be able to implement on their own. Next slide. So now it's time for our OSNAP walkthrough. So the thing that you'll be doing with your OSNAP walkthrough is first you'll be signing in on the website, and you'll get this personalized dashboard. You can see here that up in the My Account part of the dashboard, this is where you put in your information about yourself. So Molly filled this out for herself. She's an after-school site director. And so this is her kind of personalized page. And then under My Program Background, this is where she'd put the information about the after-school program that she oversees. So she'd put in, the zip code of where it is, the program affiliation, how many kids that are in the program, and the duration of the program itself. And so these are just some basic information that will be helpful for describing what your program looks like. And so after you submit this part, then you can really jump into all of the different pieces of the MyOSNAP that are tracking your progress. You can see Molly here has actually completed her 4 days of her practice assessment already, and she's going in to complete her 5th. And we really recommend to folks that you do 5 days of this practice assessment. This is a validated tool, and it's designed for after-school program staff observation of their program. So here she puts in the date that she's doing her practice assessment. All the details of how to fill this out are at the top of the form. And first she answers some questions about physical activity. Then she goes on to answer some questions about the screen time that was offered at the program that day. Next, some questions about nutrition. So what did she serve at snack to the kids? What kind of outside sugary beverages did she see or not see? And this is really what's being served. Again, fruits and vegetables, water, whole grains, things like that. And so then she's finished the practice assessment. It probably won't go that fast for everybody, but it should be 5 to 10 minutes of just what did I do today? And now that she has 5 days of that practice assessment, she can see all of the OSNAP standards or goals and how the practice assessment lines up to those goals. So in red, you'll see things that she didn't reach on any days. Orange, she reached on some days, and green, she did great. So here she's going to check off all of her orange and red goals that she didn't quite meet before. That's really her strategy here. And she set 5 goals for trying to make program changes over the next several months. Now it's ready for her to go into the action plan builder. And all of those goals that she wasn't quite meeting before, she's going to dig into more. She's going to answer some yes or no questions about each of these goals. So here she's starting with physical activity. And as she walks through each of them, now she's got a few more action steps that she can be thinking about. Those yes or no questions helped her think about things that she might add to her action plan. So there might be policy action steps she takes, practice action steps she takes, and communication action steps. And you'll see there's these open-ended questions as well. She can add her own action step as well. So we try to give you ideas for action steps that could be applicable to your program based on the yes or no questions, and then give you the opportunity to add in your own. And you'll see a lot of these ideas for action steps are actually taken from programs that participated in OSNAP in the past. And so she's finished her physical activity. She's going into her screen time. So now she's got questions around TV or movies, digital access, things like that. And she's checking off the action steps that she'd like to take over the next couple of months. So I hope this process makes sense to folks. We usually suggest that you don't set more than 5 goals. So we're thinking 3 to 5 goals in any particular session of OSNAP. So trying to do more than that can be really tricky to try to prioritize. And hopefully these yes or no questions will help you kind of narrow down your focus. So she's getting close to the end here. Now it's time for her to view her action plan. She has goals for all of the areas she needed improvement, and she can go in and add who's going to be responsible for each of these action steps and the target date for completion. She'll also be able to give status updates at multiple times over the course of the year. If you're part of a learning community, we do this 3 times, and this will help us track the progress we're making over time. So hopefully that was a helpful walkthrough of MyOSNAP. I'll definitely be able to take questions later. I know that was a lot, but I hope it mostly exemplifies really the interactivity of this approach, how we really guide you through each different part of MyOSNAP, and how useful that dashboard can be. Okay, so now we're going to our resource library. Our resource library helps us be able to look at all different types of materials that have been developed in OSNAP. So here you can search by goal. We're gonna and search by so we've got all kinds of different resources that have come up for sample schedules, for healthy staff. And here you can also search in the bar on the right side. So here Molly's interested in looking for physical activity resources. She searches for physical activity and it pulls in all the physical activity pieces we want. So there's multiple sorting functions that help you find each of the different resources we have, or you can just look by tip sheets, by fast maps, by our food and fun curriculum over on the left-hand sidebar. Lots of different ways to find all these resources. Here's an example of what a fast map looks like. These questions are actually the yes or no questions that you're filling out in your action plan builder. So this is just a paper way to start thinking about how to make action steps at your program. And I kind of think of it as a choose your own adventure, asking a question to somebody, and then based on that question, what are the different types of steps they might want to take? Okay, next slide. So now that I've walked through all of our resources, I just wanted to reiterate again that there's many ways to bring OSNAP to your program. You can explore our resource library for practice and policy strategies around a particular area. You can create one of those OSNAP accounts and really track your progress over time to develop a tailored action plan. You can log in to the on-demand course that's offered by Better Kid Care, really fantastic resource. Or you can contact us about how you can build the capacity of staff through a local learning community through our train the trainer model. We'd be happy to talk to folks about how you can bring OSNAP to your local community. So with that, I think I'll wrap up and excited to take your questions.
Awesome. Thank you so much, Bekka. That was such a great overview of the origins of OSNAP and what it's all about, and to have you do a deep dive into our site, particularly that MyOSNAP section, I think was just so great for folks to see. So we really appreciate that. With that, I'm going to move us into our full group discussion here. So please feel free anytime, put your questions or comments in the chat. Feel free to come off mute and ask your question verbally, whatever you would like. I will get us started with a question I have here, though. So, Bekka, could you tell us any examples of how after-school programs have successfully implemented OSNAP?
Gotta unmute myself. Absolutely. Thanks so much for that question. So there's so many great examples. And actually, one of the things I wanted to highlight again is that many of the successes of OSNAP are actually built into the materials. And so some of the things that I can think of are all the innovative ways that folks locally in Boston were thinking about how to serve water to kids. And it seemed really simple in the beginning, but there were different challenges logistically to trying to get that water to kids on the table at the time of the intervention, and helping people think about how do they partner with their food service staff and the folks that are in the kitchen of the school that they're based at, and how do they make sure they have access to the clean drinking water that's at their school. And then how to communicate that home to parents and be able to say that in a way that is really positive and health promoting. So I think water was one of the hugest changes we saw in our initial trial of being able to do that really simple thing of get water on the table to the kids, even when there's all these administrative and physical barriers to doing the work. So I think that's one thing that I wanted to mention. And then I think more on kind of the creative side of things, we've seen ways of programs. I remember in my study scaling up nationally of ways of staff really engaging kids in activities that kind of align with the practice changes. So as they're serving more fruits and vegetables to kids, getting kids involved in understanding why that might be happening, getting them creative and excited about those healthy changes that are being made. And I think that having that buy-in from staff and kids as you're making those practice changes can be really important. So just a couple of examples there.
Awesome. Thank you, Bekka. I just want to call out in the chat, Avery asked a question, could we have the link to the on-demand course offered through Better Kid Care? Thank you so much for that question. Looks like Angie has shared that link in the chat, so just wanted to call that out for folks who may not have seen that.
Great.
I see a question here from Lori. Sorry if you already covered this, but can state coaches link with OST programs to see their progress, or is it confidential to the programs alone?
That is a really great question. So all the data we collect in the MyOSNAP part of the website is about practices and programs at the site level. So we're not collecting data about individuals there. So because of that, or largely because of that, we have developed a part of MyOSNAP where somebody who's convening multiple programs can come in and see the progress of all those programs together. That is a new feature of our website, and actually we just added a new kind of way to contact us to get those rights. So you would have to work with us to kind of identify which programs you're working with. So say in your state there's 10 programs that are going to be working on this, making sure we know what names to kind of put in your profile as a coach or TA for that group of sites. And then absolutely, we've thought of ways, actually with our local health department team who've used OSNAP, of what's the most useful way of having a dashboard for that kind of person overseeing multiple programs. What are ways that you can kind of check in with folks over time to be able to make sure they've moved from their practice assessment to their action plan? Have they updated, their checkpoint 1 after their action plan? So all of that stuff could be available to you if you work with our team to set up a special profile for yourself.
Great. Thank you, Laurie. Great question. So another question I have for you here, Bekka. So what are some key challenges that after-school programs typically face when implementing specifically nutrition and physical activity improvements?
Great question. So I already mentioned kind of all of the contextual factors that can really challenge folks. One challenge that we encountered early on in our research was here locally in Boston, kids get their snacks in different types of ways in after-school programs. So sometimes kids are getting their snacks from their school, the school food service. There's a kitchen there where the meals are being prepared. Sometimes they might be getting pre-packaged meals that are coming from an outside vendor. And then other times kids might be getting meals, if their site directors are going out to BJ's or Costco and, purchasing food and bringing it to the program. And so one challenge that we identified locally was how you really need to be thinking about making nutrition changes so differently with those different contexts. And so we saw really great changes among sites that had that full service kitchen because they had the ability to make those changes. But if they were working with a larger vendor, it was much harder to make those changes. And so we've developed guides for things like making menu changes and working with food service and thinking about those kind of administrative challenges, I think is so important to do early on if you want to be making, changes. One thing I'll say is once you do make those changes, I think they're a bit easier to sustain because you've kind of built them into the menu. Maybe you've built them into a new contract with a provider. So it could be much more sustainable as long as you kind of overcome that administrative hurdle.
Great, thank you, Bekka. And
Yeah.
some of those guides that Bekka was referencing are all available in the resource library. So if any of those piqued your interest, feel free to take a look there. So another question I have here, how adaptable is OSNAP to different types of after-school programs, particularly those with varying resources, budgets, and demographics? And then is it culturally sensitive?
It's a great question. As I mentioned earlier, we first tested OSNAP here in Boston, but then we have worked with partners across the state and the country to test OSNAP in different types of settings. And so I think we can safely say that it works really well in different types of places. And there's a couple of reasons for that. The first reason is we're focusing on changing practices and policies and changing those environments rather than kind of focusing on trying to make individual behavior change, which I think needs more adaptation than changing practices and policies. The other reason is OSNAP is kind of a guide or a process to making change, but sites know their populations, their programs best, and they can set action steps that work best for their particular program. The way that I think of it is we say kind of the what of how to kind of roll out OSNAP, how to have a learning community, a lot of different resources for how to reach particular goals. I think what's really important about OSNAP is it's focused on those goals, but how you reach those goals can really be decided by the staff at the program. And I think that's how you make it adaptable. The model is in itself made to be contextually appropriate for a particular population or area. And coming to cost, we think a lot about cost with OSNAP. I don't know if somebody can put the choices OSNAP resources in there, but we do think about this as a pretty low cost option. We think about what are some low cost, healthier alternatives for snacks when we're thinking about making changes. So this shouldn't be about purchasing lots of new stuff. The largest cost to OSNAP, as many public health programs are, is the cost of the staff. And what we try to do is we try to build in staff, training and things like that into existing meetings. So you're not trying to, add on lots of additional costs.
Excellent. Thank you so much, Bekka. And yeah, thanks for mentioning. So here at the Choices Project, we do have some resources about OSNAP, as Bekka said, where we've kind of costed out things. We also have a listing of kind of the activities and resources, and then who would lead those activities and resources. So we can include some links in the chat, and we'll also include them in our follow-up email as well, if you're interested in more of those kind of operational pieces. So excellent, thank you. So another question I have, and I think you hinted at this like a little bit in one of the answers to your previous questions, but how does OSNAP ensure sustainability and then kind of long-term impact on nutrition and physical activity behaviors in after-school settings?
Great question. One of the things that we added to OSNAP after the first year that I think was really useful is at the end of our third learning community session, if you're doing kind of the whole OSNAP, but also in our tools and resources, if you just wanted to find that one thing, we have some guidance around some activities to help after school site directors think about, and their staff, to think about how to proactively sustain the changes they made over the course of the year. So what are ways that they can kind of set in stone a practice with a policy, or what are ways that they can communicate out to leadership about the great progress that has been made over the course of the school year. And so I think having that intentionality built into the intervention of like, how is it best to sustain this work here, is really important. The other thing that we know is tied to sustainability is staff turnover. And so we also have developed some resources around sample interview questions and job descriptions and things like that, that can be helpful to think about if you're bringing in new staff, how could you bring in new staff in a fair way through to HR vetted materials, which I think is important. To continue to promote nutrition and physical activity in your program. So bringing in those folks that are going to really help foster all that change that was made in the previous school year with the new staff that might come in the next school year.
Great, thank you, Bekka. And yeah, thanks for highlighting the piece about staff turnover, because I know that is a very real problem for lots of people. Appreciate you mentioning that. So I think maybe you've touched on this a bit, but are there some strategies that are recommended for kind of, securing buy-in from staff, parents, and then sort of the broader school community?
Yeah, absolutely. So we have a lot of sample letters that are part of the policy writing guide, and I think that's probably the most useful resource there. And as I mentioned before, these are letters that we have adapted from letters that site directors have written themselves in the past, and they're really ways of communicating out to folks about why a policy is now in place. So a good example would be, we're not going to be allowing soda at our program anymore, or sugary drinks at our program anymore, and coming up with language that really communicates why that's important to the program, what the rules will be around that policy. And I think having those communication documents that are aligned with the policy changes you're making is so important to be able to say to folks, this is going to be starting next month, we want to let you know about it. And so there's that kind of clear communication about that policy. I think with policy change, that's the biggest piece, but you could think about this also in terms of bring staff in to, an early staff meeting, talk about how they need to be, role modeling during the program time. In our experience, the staff were quite good at, role modeling healthy behaviors, healthy drinking, healthy physical activity. Sometimes those outside partners that are coming in to maybe offer additional enrichment activities, you might have to have conversations with them about, let's make sure we don't have candy as a prize, or let's make sure you build in physical activity to the hour-long time that you have them sitting. So I think just setting those expectations early on in that partnership is most important.
Great. Thanks, Bekka. And I think for folks too, so Bekka was saying we have kind of those sample letter templates. So I want to highlight as well that those are available in the resource library. They're also there's links to them and sample language as well included in our implementation guide, which again can be found in the resource library. I think we've put a link in the chat, and we will include a direct link to that as well. But that's a very important kind of overarching resource as well too. So be sure to take a look through those. So I have a question here, Bekka, about partners for out-of-school time providers to work with. If you could elaborate on some of those kind of key players. So for example, school personnel, like physical activity coordinators, who would be involved?
Oh, that's a good question. I think it really depends on the after-school program. So some after-school programs are like in a standalone community center. Some are like based in an actual school building, but run by, say, the YMCA or the Boys and Girls Club. And I think different partners are going to be needed for different types of settings. So if you are a program that's based in a school, but you're not the school running the after-school program, I think developing the relationship with the PE teachers and staff to make sure you have access to physical activity facilities, the cafeteria staff and things like that, to make sure you are on the same page about serving water, having healthy snacks, but also leadership buy-in. So who's the principal, vice principal that kind of signs off on you having that space in that school? And then how can you make sure that you're aligned in terms of nutrition and physical activity, in addition to what, hours you're allowed in the building and custodial decisions and things like that. So those are the types of people that I'm thinking about for school-based programs. And then I would also say, if you're in a program that is maybe more standalone, thinking about what are the partners that you work with who, like I was saying before, that might come into the program to offer particular clubs or special activities, making sure you're aligned with them in terms of priorities. And then any maybe facilities that you might go to use their facilities. So maybe there's a school down the street or a rec center down the street, you use their gym, making sure that you're kind of on the same page about that. So I think it would be your neighborhood environment, your partner environment. And then I would also just say, in all of these instances, partnering with other after school programs who are trying to improve nutrition and physical activity in your area, so you can learn from one another. I think the number one thing that was most kind of rewarding to folks that were part of OSNAP when we developed this intervention was that co-learning, was that, oh, they tried that worked really well, maybe I can try it at my program. And so if you have a group of after school programs that are all trying to work towards the OSNAP goals, you can have much more creativity and collaboration, and you might, be able to work on some of these goals together.
Great, thanks. Thanks, Bekka. Yeah, thanks for painting that picture of just kind of all the different folks who could be involved, and also for lifting up the importance of peer-to-peer learning, especially on this topic in particular. It's just so very relevant. So thank you.
Yeah.
I just want to pause. We're getting a little bit close to the end of our time here today. So if anybody else has other questions, this would be a last call. We have time for maybe one more. So I'll just pause and see if there are any questions. And if no questions, we do also love to ask at the end of our coffee chats if there's anything in particular that you'd really like to share in the chat that you're going to take away from today's chat. So maybe you're going to get right on osnap.org after this, or check out MyOSNAP or the resource library, or something you learned that you didn't know about before today. Feel free to include that in the chat. We'd really love to see. So I'm just going to share a couple of final things here. So we always welcome as well any ideas for future coffee chats. So please put those in the chat too, or reach out to us at any time. We're sharing our email address on the screen here, so you can let us know. We also want to invite folks to register to join our Community of Practice online portal. You can access all of the coffee chats, resource roundups, and a bunch of other resources in that portal, and a member directory as well. So you can kind of browse people in your either geographic area or by topic area. So really encourage you to check that out. We will also be having a post-event survey that's going to pop up on your screen after this. It should only take you a moment or so, very brief, to fill that out. So we thank you in advance for your time in sharing your feedback. We so value it. And again, a friendly reminder that we'll be sending out the recording, a document with all of the links and resources that we shared today. So please be on the lookout for that. So I think with that, we'll just say thank you so much to Bekka for such a wonderful presentation, and thanks to all of you for joining and for engaging with us. So thanks, everyone.
Thanks for joining.